Hello, I am Christopher Pleasant. Today I am presenting information on the current nursing shortage in our healthcare system. I will show why there is a deficit in nurses, what effects these deficits have, and the steps needed to curb the lack of nurses in order to protect the general public's safety. Nurses are the bedrock of the American healthcare system. A licensed nurse eventually touches the life of every citizen. At birth, people are cared for by nurses and midwives. At each doctor visit, a nursing assessment is involved. And when cared for in an assisted living facility, patients are attended to by licensed nurses. The American Nursing Association estimates there are 3 million nurses in the United States. Advocates have been foretelling of an impending shortage of nursing professionals. The current capacity of nursing schools is to graduate around 135,000 new nurses every year. The Bureau of Labor and Statistics reports that each year until 2030, about 150 additional new nurses will be needed. That's a shortfall of about 10% every year. Over the next decade, the deficit could grow to 500,000 nurses. Several factors lead to the creation of these job openings, including an aging population, increasing nurse resignations, and a limited supply of new nurses. By the year 2030, every member of the baby boomer generation will be 65 years old. Currently, the baby boomers are the second largest generation in our nation. And as these people age, the incidences of chronic medical conditions will increase. Having more chronically ill people will put a strain on our healthcare system unless it is fully staffed. Turnover and retirement in the nursing profession is a concern at all healthcare facilities. In 2022, USA Today did a poll that found that about 90 or 50% of nurses felt burned out professionally. Additionally, about half of the nurses that were burned out said they would leave the profession in the near future. Along with these burned out nurses, there are also many retiring in the next few years. Today, the average age of a nurse is 44 years old, with a portion of nurses over 55 being somewhere around 23%. If they all retire to age 65, that's about 750,000 nurses that will retire in the next 10 years. And just as there are fewer nurses providing health care, there are fewer nurses providing education to new nurses. The Oklahoma Nurse, a trade paper, reported that in 2018, four-year nursing schools turned away about 75,000 prospective students from baccalaureate programs due to staffing shortages, inadequate classroom space, and insufficient numbers of clinical preceptors. Associate-level nursing programs turned away approximately the same number of people. When there are fewer nurses working, the available nurses care for more patients. Increased nurse-to-patient ratios lead to a variety of adverse effects. Incidences of medical errors, procedure missteps, and adverse patient outcomes increase. Fewer nurses available means that people will have to wait longer and travel further to find proper medical care, and taking care of more patients eventually equates to higher rates of job burnout and providers leaving the profession. Since the beginning of the nursing shortage, the focus has been on retaining current staff while trying to attract new nurses for employment. Increasing pay is the first go-to solution for most, but this only keeps a certain number of nurses from leaving your facility. It does nothing to increase the number of nurses in the work pool. Another technique to keep nurses in the workforce is to empower nurses. This intends to create an invested interest between nurses and the hospital. Empowerment does improve patient outcomes and keeps nurses in the workforce a little longer, but it does not increase the total number of nurses. And due to the high rate of burnout among nurses, there is a work-life balance programs going on by decreasing the rates of burnout in hopes to keep nurses in the workplace a little longer. The prominent solutions against the nursing deficits do not create the volume of nurses needed to provide for future care. If we are to meet the future healthcare needs, a plan needs to be in place to increase the number of nurses educated every year. The solution is multifaceted and will integrate the government, healthcare providers, and business organizations, as well as medical manufacturers. The first step is to have the federal government declare the current nursing shortage a national health care emergency. In 2021, the president of the American Nursing Association wrote a letter to the Secretary of the Department of Health saying that a national emergency needed to be declared in the public interest. Once this emergency is declared, funds will be made available from national emergency coffers in order to invest in nursing schools. This money will be used to upgrade and construct new institutions of learning. Such grants or such monies will be doled out in the form of grants. While federal funds are used to upgrade physical facilities, healthcare organizations will be needed to supply nursing instructors. Hospitals could partner with local nursing programs to help provide nursing educators needed for large student populations. Hospitals and larger clinics can supplement open education positions with their staff, while incentivizing their staff to teach part-time and work in the hospital part-time. Insurance companies will be needed to provide scholarships for nursing education, while medical manufacturers will be needed to provide the technology and medical supplies to nursing education institutions. By donating such materials, these companies could receive tax donations or deductions, and manufacturers could also create brand recognition with nursing administrators of tomorrow. The solutions presented in this proposal represent a significant investment of money, time, and materials. By dividing these investments between government agencies and the private sectors, the overall cost will be easier met. Each entity in this proposal has a real stake in eliminating the nursing deficit. Investments made to expand the educational opportunities in nursing are the only practical solution to the nursing shortage. All other answers are stopgap measures that keep the present nursing practicing for a couple of more years. Eventually, all nurses leave the profession. If the rate of attrition outpaces the rate at which nurses are produced, the nurse deficit continues. The number of people getting older and needing more nursing care is a factor that cannot be slowed down. It can only be mitigated by increasing the number of nurses available to provide care. The nursing shortage is an authentic crisis that will touch all lives. To ensure that both the quality and quantity of life are elevated for everyone, the nursing crisis must be addressed through the expansion of nursing education. Thank you for your time. I'm Chris Pleasant.